Okay. So here's our review for the final. And so I'm going to use an old exam. Just gotta find what I do with it. What I do with it. Here we go. Okay. So let's see. Let's see if you actually know the answers. Okay? Just for fun. Can you guys hear me?
Copy.
Copy that. All right. Good. I'm trying to. There we go. Okay. I'm going to read the questions and see if you know it. Okay. In the United States, the standard for defining types of mental disorders is contained in the.
The DSM.
Yep. Two. What is a culture specific disorder?
I feel like it's really simple. I just have to look at the answers.
What's a culture specific disorder? You do know this. You guys, come on. A culture specific. What does that mean to you? It's a
I can't
disorder
think of it.
seen. It's a disorder seen only in certain cultures.
All right. Yeah.
Okay. What is epidemiology?
Um,
I'm literally reading the questions. Okay. Is it an exploration of what forms of treatment are most effective? Is it a form of psychotherapy? Is it the study of the role of genes in mental illness? Or is it the study of the distribution of a disorder in a population?
the last one.
Correct. What does comorbidity mean? Chloe, you know this. Comorbidity.
I'm not sure.
When something's comorbid.
Hmm. I'm trying to figure stuff out right now because my coworkers are calling into work right now. So
Okay.
I'm sorry that I'm on my phone.
Tirza, what does it mean that something's comorbid?
Um, I'm not sure.
All right. What two disorders are best friends?
The anxiety
Mm-hmm.
and
And
depression.
yes. And so we would say that depression is comorbid with anxiety, and anxiety is comorbid with depression. It means that the person has two or more disorders. Describing a disorder as acute means what? What's the opposite of acute?
Obtuse.
Chronic. So what's a chronic disorder? What does that mean?
I kind of mean like major.
It means that it lasts a long time. So acute means that it lasts a short amount of time. Does that make sense?
Mhm.
Okay. when we have an experiment or when we conduct an experiment, we have to use a sample. Now, what does that sample have to be, ideally?
A random sample?
Okay, yes, we do want it to be random, but that's not. Random samples help with what, though?
Like a generalization of.
Good. Which means that the sample is what? Is it random, representative, generalizable, or demographically pure?
I would say generalizable, right? Or no?
See, generalizable, so because the answer is representative, and that
Okay.
means when we have a sample, it has to be representative of the population, meaning all the demographics are taken into account, that we have a similar percentage of male
Yeah.
and female that we would see in the pop. You get the idea. Okay.
Yeah.
Which means we can generalize. We have
Hmm.
external validity as a result of it. Okay. All right. The next question. Each of the following is one of the four humors, except, and they are blood, phlegm, phrenitis, or bile.
Phrenitis.
Correct. In
This is
19,
definitely a lot more helpful. I really do like this. I just
oh,
wanted to say.
okay, good. Good. I'm glad this is helping. In 1983, a large group of West Bank Palestinian girls showed signs of illness. Some thought they were poisoned, but later it was discovered that psychological factors played a key role in most of the cases. This incident best illustrates what? Chloe, we just covered this in social psychology.
Could you repeat that again, please? Question.
In 1983, a large group of West Bank Palestinian girls showed signs of illness.
Oh, contagion.
Good. What's another name for contagion, though?
Uh, I don't remember that one.
Mass madness.
Oh yeah, yeah.
Okay. Who was Dorothea Dix?
She the one that like she wanted like better mental health for.
Correct. Very
Okay.
good. Freud is the first to describe the blank, that the mind could contain information of which it is unaware, but by which it is still affected. We described what? He focused on what? He researched what? Freud.
Mm, I'm not sure.
Tell me anything that you know about Freud.
Um,
Okay. Here are your choices. Freud is the first to describe the blank. Is it catharsis, unconscious, hysteria, or operant conditioning?
The operant conditioning.
No, that's Skinner.
Oh, I thought you said. I thought Freud was part of operant conditioning.
No. Nope. Freud did dream analysis, free association. He was part of the psychoanalytic. He invented the psychoanalytic movement, saying that it were these unconscious drives, the ego, the superego, the id. A psychologist, a psychologist who takes a behavioral perspective would focus on what? Learning, early experiences, unconscious conflicts, or the role of behavioral factors? This is a tough one, but
Uh,
let's go to the next question. The answer was learning. The central principle of operant conditioning is what?
yeah, I'm not sure on this one.
I'm not really sure what to do with this. This is something that we've addressed in intro, social, abnormal, human development, applied psych, human sexuality, classical versus operant conditioning. The idea behind operant conditioning is that the consequences of behavior results in the likelihood of it being repeated or not. If it's a good consequence, they'll do it again. If it's bad, they won't. I'm going to keep going. All right. Dr. Fox studies the causes of depression. In other words, she looks at factors that play a role in the blank of depression. So they're asking, what's another word for cause? Or the development of, studying the development of. Is it etiology, epidemiology, prevalence, or resiliency?
Is it prevalence?
No.
I tried.
Okay, you did try. Prevalence is the total number of cases that exist of a disorder or disease.
So the second one?
Epidemiology? No.
Never mind.
It's etiology, also known as etiology. Childhood abuse is commonly seen in those who develop dissociative disorders later in life. Childhood abuse would best be described as a what kind of cause? A necessary contributory cause, a proximal contributory cause, a reinforcing contributory cause, or a distal contributory cause.
The third one.
A reinforcing? No, it's distal because it's something that happened a long time ago, but now it's contributing to it, the development of it. Proximal means it's just happened and it's causing it. Like it could be like post-traumatic stress disorder, like you just went through something very traumatic. That's proximal. Distal is it happened a long time ago, but it's making it happen now.
Huh.
All right, I'm going to skip some of these things. All right, let's try this. You ready? The site of communication between two neurons is the
Neurotransmitter.
the site.
Synapses.
Oh,
Synapse.
yeah.
Correct.
I knew that one because you hammered that in our brains in 101.
Thank the Lord. Okay. Okay. What do you know about a clinician's professional orientation and assessment for diagnosing? Think of professional orientation as professional training, professional education. All right, crickets. What does it mean when a test is reliable? What is the term that we use to refer to efforts to deal with stress?
Coping.
Coping.
What are some things that are linked to a person's ability to cope better? Forget about what you learned. Just think about what is obvious. Like some people can cope better with stress because they have what?
Resilience. Or no, is that?
Yes, that could be one, but that's not on the list.
Okay.
And actually, resilience is. No, you're right. Go with that. Okay. You're going through a bad breakup. What's going to help you get through that breakup?
Support.
Yes, social support. What is the fight or flight? What are the parts of the body that are responsible? What's the axis for our fight or flight response? What is a typical symptom of a panic attack?
Heart beating fast.
Yeah, but that would happen if you're running, jogging, playing tennis. What's a typical symptom of a panic attack?
It's like you can't really time it. It's kind of like unexpected or
Okay. Yep. The onset may be cued or uncued. That's true. It's a fear of dying. What do all mood disorders have in common?
I'm not sure. Can you read the answers off?
Sure. The presence of negative mood states, or they are at least 6 months in duration, or the presence of irrational thoughts, or they are characterized by emotional extremes.
Are they characterized as emotional extremes?
Yes. The question is, which of the following is most likely to attempt but not complete suicide? Is it 14-year-old Joan, who has been depressed since her parents' divorce? Charlie, a 16-year-old with a history of petty crimes? 12-year-old Paul, who received constant rejection from the girls at school? Or Crystal, a 14-year-old substance abusing teen who has been diagnosed with attention deficit disorder? Who
Well,
was most likely to attempt but not complete?
I'm thinking the last one.
Crystal, a 14-year-old substance abusing teen?
I think the first one.
It's the first one. 14-year-old Joan, who has been depressed since her parents' divorce. And why is it the first one?
Just because she like already has depression, like she has those thoughts and tendencies right already, so I feel like that makes her more likely to attempt.
But not complete.
Right.
So why not complete? The other three are more likely to complete, though. Why is 14-year-old Joan, who's been depressed since her parents' divorce, not likely to complete it?
What is complete? Like, does that mean? Like,
You've committed
action?
to it. You did it,
Oh.
yes. I guess you have to think about the reasons for doing it.
I guess because she's so young.
Well, the other one's 14 years old, too.
Oh.
Okay. The next question. Which of the following is a characteristic of the binge eating purging type of anorexia? So what does that mean? Binge eating, purging. How do you purge is what it's asking. What are ways to purge?
Like, not like, what do you mean by purging? Like with binge eating?
Purging. Think of bulimia nervosa, right? And so you have the binging and then you have the purging. What does that mean? Purge.
Well, you're not eating anything?
No, that's food restriction.
Like throwing up, or
What's another way other than throwing up? The use of laxatives.
Mm.
The families of people diagnosed with anorexia, how are they similar?
I'm not sure on this one.
They're perfectionistic. Okay. I don't care if you want to do this or not, but that's not working. Here we go. I think you'll get more out of this, believe it or not. I really do. You ready? Okay. Chloe, you're first.
Mental disorders for 20.
Answer. Statistically rare, socially deviant, maladaptive, and personal discomfort.
Is it a personality disorder?
Nope. Tirza,
What was this category? I'm sorry.
mental disorders.
Okay. Is it the BPD?
Nope. It's the criteria for abnormal behavior. Tirza, you pick.
Okay. Hodgepodge for 30.
The treatment recommended for a patient at the mental hospital is phototherapy. Phototherapy. What's the disorder?
I'm not sure.
Chloe?
What is about? Is that a personality disorder for this one? No, it's not. No, it's not. No, it's not. I take that back. It's definitely not a personality disorder. It's a
Phototherapy.
oh,
Phototherapy.
it's like with like the cards, right?
Phototherapy.
I don't know
Seasonal
what-
affective disorder. Chloe, your pick.
Schizophrenia for 10.
An excess or distortion of normal functions are called what?
My God, I don't know. It's hard to think.
This one's a more difficult one. Tirza?
Normal functions. If it's difficult, I probably don't know that one.
They're called positive symptoms.
Oh.
Positive symptoms are symptoms of schizophrenia that you gain, like hallucinations, delusions, tics. Then there are negative symptoms, things that you lose, like a flattened affect, meaning a flattened emotion. You don't enjoy the things you used to.
I'm gonna pick mental disorders for 30.
The fear that one's penis will withdraw into the abdomen is known as what?
Coro?
Yes. Very good. We're on our way. Let's go, Chloe.
Hodgepodge for 20.
Answer. Attributing a mental disorder to chemical imbalance would be using this perspective or approach.
A biological.
Thank you. Let's go. That was for 30 or 20?
20.
Okay. Tirza.
We'll do therapy for 20.
Therapy 1 or 2?
Oh, 2.
Answer. Electroconvulsive therapy has been used successfully to treat this disorder, also known as shock therapy.
Like schizophrenia, maybe?
I think I might know it.
Okay, let me pass.
Is it depression?
It's depression.
Oh.
So I believe it has been used for schizophrenia, so I'm going to give you half of that, Tirza. Okay. Chloe.
Therapy for 50.
Which one?
1.
Answer. An advantage to group therapy. Like if you're using group therapy, what's one of the advantages?
Like you get other people's perspective on what they're going through, and it might help you out.
Okay.
Group think and stuff like that.
Not group think. You don't want group think.
I don't know. You have the other people supporting you.
There. Social support. Tirza.
Schizophrenia for 20.
Answer. a biomedical form of treatment for delusions and hallucinations. What would you prescribe for schizophrenia?
Is it lithium? No, I don't.
No, right? Keep going. What would you give? What would you prescribe someone with schizophrenia?
I
As soon
can't
as I show you the
recall.
answer, you're gonna
Yeah,
be
I know I'm gonna slap myself in the
yeah,
face.
you are. Chloe?
It's not serotonin, is it?
No,
No, I
the opposite. It's an antipsychotic.
Uh,
All right, Chloe, your pick.
Therapy for 30. One. Do therapy one.
The process of learning through the observation and imitation of others. So, they're saying, hey, look at that person, how they're doing it. What is that person doing?
Trying to like look at how other people are like
What's the
coping.
person that's doing it, that's being watched? What are they doing?
The person that's being watched is I don't know, like they're not
What
I'm
would
not
you call a person that is doing something while another one or others are watching? They are serving as the
they're serving as like the I don't know what the word is, like they're learning from them.
Yep.
I want to say like they're serving as like almost like a surrogate, but I don't know.
No. Tirza.
I don't know, like test subject. I don't really.
Modeling.
Okay, participant.
Okay. Tirza, you're up.
We'll do therapy for 32.
Prozac.
Is this like what it's prescribed to?
Yes. Who would get Prozac?
I'm just gonna take a guess. Maybe anxiety.
Depression. Oh, Chloe, I'm sorry, I forgot.
Oh, that one's also okay.
It's for depression.
Noted.
Chloe, you're up.
Hodgepodge for 40.
Answer. A disorder that takes the form of a bodily ailment that has no physical cause.
Oh my god, it's so what? It's yeah, I know what it is, but it's like it's not there, and people think it's there.
Yep.
I don't know what it's called.
Tirza.
This one's gonna. It's not hypochondriac, but it's like we learned it at the same time.
Mm-hmm.
Don't remember. Yo no sé.
It's a somatoform disorder. Tirza. When you're ready.
We'll do mental disorders for 40. I'll be back.
The fear of heights. I'm not going to ask you to know this one. I don't know why it's in there. It's acrophobia. Pick another one.
Okay. We'll do hodgepodge for 50.
The primary purpose of the DSM.
To like categorize like their symptoms. Oh no.
What is it?
So like
what do you use the DSM for? What is the DSM? What does it stand for?
Diagnostic.
But what are you using it for?
Diagnosing.
Okay. Chloe.
Therapy for 50.
When a patient begins to see the therapist as somebody very close to them, almost like a parent, it's called this.
Um, it's like they become like an emotional support.
What's the term for it when they begin to see them, the therapist, as someone close?
I'm not sure.
Tirza?
Mm, I don't.
Transference. Tirza, your pick.
I'm gonna choose schizophrenia for 30 points.
Periods of statue-like immobility mixed with bursts of wild, agitated movement and talking is this kind of schizophrenia.
So like, I know there's one that's like where they're lonely, and then this is the other one. It's not. Is it schizoid?
It's not schizoid or schizotypo.
Oh,
It's a because those are personality disorders.
okay.
This is schizophrenia. It's a kind of schizophrenia. Like there's paranoid schizophrenia, there's disorganized schizophrenia, and then there's. Do you know it, Chloe?
Oh no, I don't.
Catatonic.
Mm.
And the key here is tonicity. That means muscle tone.
All right,
Okay,
though.
so after 4 rounds, it is tied at 90 each. All right, Chloe, you're up.
Therapy 1 for 40.
Therapy that depends on identifying and changing distorted thinking and unrealistic beliefs. Beliefs. Thinking.
Cognitive.
Yes, cognitive therapy. And that was worth how much? I forgot. 40?
40.
Tirza, you're up.
Therapy 2 for 40 points.
Suddenly exposing a person to the thing they are afraid of most without letting them escape from it, like dumping a bucket of spiders on someone's head. It's a kind of exposure therapy that we call.
Ooh. This is like the one where you take them down the stairs each time, like a little bit by little. Someone's
Nope,
like,
that's systematic desensitization. That's step by step. This is all in. That's it. You're afraid of heights? We're throwing you out of a plane.
probably like not. I don't know. That's I wouldn't. That's not cool.
You know, Chloe?
Is it like a phobia treatment? I don't know.
It is, but what's the term? What do we call it? Do you know it, Alex? Oh. What is it, Christina? No, it is a form of exposure therapy, I said, but this particular one is called flooding. Yes, no, people will poop themselves, they will throw up,
Oh, that makes
cry. Yeah, it takes a couple hours, but yes, they do. All right, who picked that?
Me.
Okay, Chloe, you're up. Let's go.
Schizophrenia for 50.
Schizophrenia?
Yeah.
The most common form of hallucinations among schizophrenics.
Like where they think people are following them.
Nope. And that would be a delusion.
Mm.
A hallucination. What do you think it is, Tirza?
What did you just say? It was that would be delusion.
Yeah, because she said that they think people are following them. That's a false belief.
Okay.
A hallucination is a false perception. So what's the most common hallucination?
Does it sound similar to delusion, or is it like totally different?
No, it's
Oh,
a
yeah.
specific kind of hallucination.
I don't recall.
You want to try again, Chloe?
No, I'll pass. Thank you.
All right, it's hearing voices. Remember that. Okay. Tirza.
Therapy 1 for 20 points.
Psychoanalysts focus on the blank as a motivating force of behavior. Freud invented psychoanalysis.
Oh. I know I'm gonna beat myself up for this one, so I'm gonna pass this one to my girl Chloe.
Chloe.
Focus on the thoughts.
The unconscious, subconscious.
I was gonna say unconscious.
Remember when we covered that in the exam earlier today?
Yeah.
That exact thing? That very exact thing?
Yeah, it's okay.
Got a bunch of salad dogs today. Chloe, you're up.
Mental disorders for 50.
Manic episodes with episodes of depression.
It's not. I'm gonna guess schizophrenia. It's a part of schizophrenia.
Tirza? Guys, this is like a Twilight Zone episode. How can you even miss this question? I don't even understand it.
I am all over the place.
Manic episodes with episodes of depression.
Oh shit.
Yeah. Yeah.
Is it mania?
Huh?
Is it mania?
It's bipolar disorder or manic depression.
The hell. You're so disappointed.
I am surprised. I mean, that seemed like an obvious one to me, but I mean, Tirza, your pick.
Let's see. We'll do therapy first. That was mine. Oh no, it wasn't mine. Definitely not.
These therapies have had considerable success in treating many types of disorders, including stress, behavioral, and anxiety disorders. It's a kind of therapy that's had success in treating several kinds of disorders: behavioral, anxiety, cognitive.
I might know. I'm not sure.
Sure. That's it, Chloe.
Is it light therapy?
No, it's cognitive and cognitive behavioral therapy.
Uh,
Cognitive behavioral therapy is the most common successful therapy that's not using medication.
Yeah.
Okay, Chloe, you're up.
hodgepodge for 10.
According to the behavioral perspective, generalized anxiety disorder is caused by this. You don't even need to know what the disorder is. You just need to know, according to the behavioral perspective.
According to the behavior. Worry?
Nope. Tirza?
I don't know.
Learning. Behaviorists are about learning. This is something else we covered in that test earlier today. All right, Tirza, you're up.
I picked that one. No, I didn't. Okay. Schizophrenia for 40 points.
Very confused in speech and tend to have very inappropriate affect, which means emotion, or a flat affect, which would be a negative symptom. Very socially impaired, unable to engage in normal social rituals of daily life, and they neglect all their cleanliness, their hygiene. What kind of schizophrenia is this? This is a tough one. I'll give you an option, okay? I'll give you a clue. Is it paranoid? Is it disorganized? Is it catatonic?
No, I'm gonna have to go with the disorganized.
Correct. Sorry, Chloe. I know that wasn't fair. I'll do the next thing for you. I'll do the next one for you too, okay?
Hey, better.
All right, sorry. All right, which one do you want? Therapy or mental disorders?
Therapy.
Eye movement desensitization therapy, reprocessing, is primarily used for this kind of disorder. Is it schizophrenia? Is it borderline personality disorder? Or is it post-traumatic stress disorder?
Is it PTSD?
Yes. Okay. Now, mental disorders for tears. Are you ready?
Yup.
To release evil spirits that were in a person's head.
What the fart? So easy.
This is a tough one. You're not going to get this one.
You're like drill
Okay.
a hole in your head or something.
Yes. Yes, that's called trepanning.
I didn't know the word for it.
Okay, that's okay, but you knew what it was. You guys want to hear something hilarious? You guys are
Yeah.
still tied. You both have 150. Or wait, no, you both have 140. Yeah. All right, so how much you going to wager?
5.
5. Okay.
I will do 5 too.
Okay. All right. So, when you know it, just yell it out, okay?
Okay.
During the Renaissance, abnormal behavior was thought to be resulted from this.
I got it, I think.
Say it.
Like possessions.
Demonic possession.
Good game. Good game. Yeah, good
Oh,
game.
good.
Chloe wins 145 to 135.
Let's go.
All right. I'm going to stop recording.